OIC, meaning officer in charge of the New Testament Medical Clinic on the Bonmars Road, Kakata City, Margibi County.
I'm Women Elizabeth Holmes from City Clinic, Margibi County.
Well, right before the crisis, the Ebola crisis, we used to hear about Ebola from the East African countries. And we didn't know, we thought it was a joke. On the news, on BBC and other news, we should hear about Ebola and we didn't know. But when it entered West Africa, meaning our country, our county, Margibi County, with every man, every woman, every child, every boy fared away. It brought fear and it brought a lot of disturbances in the health sector, in our communities, in our homes. We lost our relatives, we lost our loved ones, we lost our wives, we lost our husband. And by the grace of God, by the help of our partners, our international partners, the Liberian government, the nurses, the health sector, doctors, even community leaders, we all fought Ebola together. And today we can see that we can no longer hear about Ebola. We are fighting now the scar that is left by Ebola in our country, in our health sector, in our communities.
We have been working harder since the pronouncement of the country being free of Ebola, and the post-Ebola situation is like we've been working harder, we've been putting things together. Like the basic thing we talk about is the epidemic preparedness process, and now we have trained the district health team. We have in Margibi County, we have the 4 health districts. We have trained the district health team in the EPR process, which means we form the RRTs at all levels. The county RRT, which is the county rapid response team, and we also form the district rapid response team at the district level. And we have the ORC and the CHSS being trained today in the same response EPR process. And we've had a lot of development since the outbreak, because at the time before the outbreak we didn't have too much of focus on IPC. We didn't have this level of preparedness being set as a priority, but now it's a priority for us. We have a team set up in every setting, and then we have the pre-positioning of all equipment that we will need in every district, so we have a set going on.
I would say we are on course, but we still need assistance, especially when it comes to the laboratory, because that's where we really focus on, because we are down with a lot of things and we need to upgrade our laboratory.
Right.
Yeah, because if we can have people that will come in to help us to upgrade our laboratory, I think then we will be on a good footing.
Well, things are fine, you know. There are a lot of changes that have been made immediately when Ebola left. With the county health team, the government, Liberia stepped in, the international community stepped in. They gave us a lot of supplies in terms of protective gear, PPE. And they gave it to us so that we can be on our guard, because we heard that Ebola come, they go and they come by, many times. So we are prepared, we are trained in the health sector to know when Ebola entered the country, what are the techniques, what are some of the things we should do that will not be able again to combat Ebola and mental health workers die. You know that, so that mental health workers will not die again.
Yes, and also for the MCH, at least if we can expand it, where we have an office space and then be able to meet our patient one-on-one, and that would be better. Then the ordinary patient can come and have in other places.
Basically, we will be talking about vehicle for the district health teams that may be used in terms of response. But for the county, we have vehicles. It's just that the district health team were just formulated shortly before the Ebola crisis, and so they are not fully mature. We don't have their transportation set up, and we are looking at the actual setting of the district health team that will be responsible for other activities, health activities in the district, even before they have the attention of the county health team.
No, everything is not well. In the midst of the financial crisis we got in the world, we are fighting it. And you know that immediately after Ebola, people are it's just now that people are gaining confidence in the health sector, coming back to the rural clinic because they have no option. They must come to us as health workers to be able to identify their needs or problems, and if possible, we solve their problems.
Because even the isolation, we need some help there, because where we just have a walk-in, and then we need where we have to change our clothes. If there's a possibility there will be an outbreak, we need where we will be able to change and have room, things there to take into the isolation room.
Yeah, there are, you know, one of the things that we find in our tropical region is this issue of malaria.
Right.
Malaria, and these are cases that we find, sexually transmitted diseases, skin infection, urinary tract infection, pelvic inflammatory disease, and other things. We talk about the eye conditions, abdominal PUD, peptic ulcer disease. These are cases that are common in our communities.
I would say yes, because from where we have moved from, though it was probably hard in people locating where city clinic is, but for now I can say that we have a lot of patients that are coming in because from the direction, yeah.
In the case of complicated malaria, and when we say things are complicated, it's hard to handle. Like with malaria, we go to the extent of people having anemia, loss of blood. It becomes grossly anemic, and blood must be transfused. You must have the blood bank, you might have the right reagent to be able to do tests and to be able to help the person. You understand? To be able to have some of the complications like for our level, because you must know your limitation. There are some conditions that we don't handle at the clinical level. Surgical matters. We are not equipped to do surgery. It is under our referral hospital, CS Running Hospital, the JFK, FEB. These are institutions that are responsible to do surgery. So for our level, we are not to handle cases that has the nature or condition of surgery. So we know our limitation.
Right now, we have also formulated a community health services. At the community level, we have recruited few number of people in every community based on catchment population, and now they are called the community health assistants, and they will be reporting community activities to the health facility, and this health facility will now report to the district health team. From the district health team will come to the county health team. So those are important issues. We like the community, we like the public to know that we have this thing as a setup in our county. So we set them up so that health will be actually from the community up gradually to the national level, instead of health coming from national straight down to us.
We want to appeal to our friends, we want to appeal to the government of Liberia, even anybody listening to us, that we need help, we need financial assistance. The financial assistance that you're running, the facilities, health facilities, I don't really want to say new destiny, but anybody listening to us, especially for private facilities, help the private facilities, because we are partners. We are the ones that lifting up government hand, because the government alone will not be able to do it. All of the people, the citizens that can come here for treatment, all of them don't go to Reading Hospital. Most of them come to us. And so we need help so that we can be able to support government effort, to be able to lift government hand, buttress the efforts of government. You know, we need help. Even if it does not come from the government directly, it comes from the partners of government, people who are helping the government to do X work, to help the functionaries of government, ministries and other agencies. These NGOs, we think, can come to our help and help us with get also financial assistance. Like for instance, we want to build an MCH, maternal child health, where we'll be doing delivery and other things. But the capacity is not there fully. They should be able to help us financially and will be able to build these units, because the concern of the international community always focus on MCH, pregnant women, under 5. So this area, these NGOs or other partners should help us so that we can be on path with government.
Right.